Good morning to everyone, to Lazaro who joined us today, to the sign language interpreter, and the audience who listens to us every day. Today again, we regret to report the decease of two persons, an 85-year-old male patient from San Cristobal municipality in Artemisa province. He was a confirmed case contact and suffered from a group of illnesses or comorbidities that were seriously damaging his health condition. He showed the first symptoms on August 16th and was admitted to the hospital on the 17th. The patient remained 16 days hospitalized, of which 7 were in the ICU, and from August 27th, his clinical picture began to worsen. On September the 1st, he developed some complications, which led to intubation and passed from serious conditions to critical. Unfortunately, yesterday he had a ventricular fibrillation and went into a cardiac arrest. Despite the efforts made by our professionals and specialists, it was not possible to revive him. We extend our condolences to his family and friends. The other patient is an 87-year-old woman from Cotorro municipality. She was a confirmed case contact and suffered from some comorbidities as well. The evolution of the disease was rather rough. She showed the first symptoms on September the 1st and was immediately admitted to hospital. However, she remained hospitalized only 1 hour. Despite the efforts and actions undertaken by our specialist, she went into a cardiac respiratory arrest, from which it was impossible to resuscitate her. Again, we offer our condolences to her relatives and friends. That said, as of today, we report 1,346 hospitalized patients, 26 under medical supervision, 682 are suspected cases, and 638 are confirmed active cases, the highest figure thus far. Yesterday, more than 5,000 samples were processed in the molecular biology laboratories of our country, 5,691 to be exact. However, our main goal is to reach 6,000 or 7,000 samples in order to detect all asymptomatic people that may be transmitting the virus in the community. 1,922 samples were processed at the Tropical Medicine Institute Pedro Coury, 782 in Havana's Hygiene, Epidemiology and Microbiology Center, 405 in Villa Claras, 280 in Santiago de Cubas, 658 in the Genetic Engineering and Biotechnology Lab, 422 in Hermanos Amajeira's Hospital, 266 in the Center for Molecular Immunology, 241 in Fructuoso Rodriguez Hospital, 229 in the National Civil Defense Center, 204 in the Naval Hospital, 182 in the Genetic National Center, 100 in the Manuel Fajardo's Hospital. As a result of the analysis and processing of these 5,691 samples, 88 people tested positive for COVID-19. This is the highest figure of confirmed cases in one day, which accounts for 414,418 analyzed samples in our country and a total of 4,214 people, or 1.02%, that have been diagnosed with COVID-19. I emphasize on the behavior of the pandemic these last days, mostly yesterday and today, regarding the number of deceased patients despite our specialist efforts and the implementation of the treatment protocols, as well as the amount of confirmed cases, which evidences the complexity of the disease. Hence, I call on everyone to engage in the compliance of all established measures, since the disease has proved to be highly dangerous. Samples from all of the country's provinces were tested depending on its epidemiological complexity. Artemisa processed 221, Havana 4,673, Villa Clara 85, Ciego de Ávila 314, Las Tunas 75, Santiago de Cuba 133, and so forth from every Cuban territory. As I mentioned, we accumulate 414,418 analyzed samples and 4,214 diagnosed patients in Cuba. Of the 88 positive cases, 87 are Cubans and 1 is a foreign resident in our country, of which 77, or the 87.5%, are confirmed case contacts. This means that the 89.8% of all diagnosed cases in Cuba have been confirmed case contacts. The source of infection linked to 11 patients is yet to be determined for a cumulative of 40 people over the last 15 days. However, our professionals keep up the hard work given the importance it entails to stop the chain of contagions. Yesterday, we did not report any imported cases. Hence, the figure of 389 patients that belong to this group remains unchanged. Of the 88 confirmed cases, 47 are male, which is a 50.4% of all diagnosed cases in Cuba, and 41, the 49.5%, are female. There are no significant differences in this regard. 63 patients, that is 71.5% of all cases confirmed yesterday, were asymptomatic, for a total of 2,469 people, the 58.5% of all confirmed cases up to date. This is a specific feature of the disease which makes difficult its control, meaning that the commitment and responsibility of the entire population is required. By age groups, 16 individuals are under the age of 20, of which 15 are in pediatric ages or under the age of 18, for a total of 441 patients in this age group. 378 of them, or the 86.2%, are recovered and discharged from hospital. 27 patients are between 20 to 39 years of age. 31 patients between 40 to 60 years of age, and 14 exceed 60 years of age. The 88 diagnosed patients are local transmission cases. None of them contracted the disease abroad, of which 69 belong to Havana, 14 to Artemisa, and 5 to Ciego de Ávila. The 14 cases from Artemisa belong 5 each to San Cristobal and Alquizar, 2 cases to Candelaria, and 1 case each to Mariel and Caimito municipalities. As you may notice, the virus has spread to several municipalities already. The 5 cases from Ciego de Ávila belong to Ciego de Ávila municipality. In Havana province, the 69 cases belong 16 to Boyeros, 11 to Arroyo Naranjo, 10 to 10 de Octubre, 8 to Cotorro, 8 to Regla, 3 to Habana del Este, 2 cases each to the municipalities of Cerro, Habana Vieja, Marianao, Centro Habana, and Guanabacoa, 1 case each to Plaza, Playa, and San Miguel del Padrón. This data shows the great spread of the disease in our country. I would like to display a map of Cuba that shows all the provinces that have reported COVID-19 cases over the last 15 days. There it is. Perhaps it's kind of difficult to observe all details on the screen, but in the last 15 days, 528 cases have been diagnosed in Havana province, 76 in Artemisa, 38 in Matanzas, 8 in Pinar del Río, 20 in Ciego de Ávila, 7 in Las Tunas, 5 in Villa Clara, and Mayabeque and Camagüey have reported 1 case each. As can be seen, a great number of territories are being hit by the pandemic. However, some of those provinces, such as Artemisa and Pinar del Río, have reported a larger amount of cases, but we intended to display their behavior only in the last 15 days. Following a map from Havana province known by the audience that reflects the great spread of the COVID-19 in this city, with a significant number of cases in the area of Arroyo Naranjo indicated by a red dot. Thanks for your support, Lillian. Therefore, Havana's confirmed rate per 100,000 inhabitants is the highest in the country, with 24.73, Artemisa's 14.76, both of them higher than the previous day. Matanzas with 5.14, same as yesterday. Pinar del Río with 1.37, lower than the previous rate. Ciego de Ávila's 4.58, a higher rate. Las Tunas 1.31, Villa Clara 0.64, Mayabeque 0.26, Camagüey 0.13. all of them with lower or similar results than the previous day. Thus, Cuba's rate per 100,000 inhabitants is 6.1. With this analysis, of the 4,214 diagnosed patients in Cuba, 638 are confirmed and hospitalized active cases, that is 15.1%, of which 617, or 96.7%, present a clinically stable evolution. At the beginning of the briefing, we reported 2 deaths, what brings the COVID-19 death toll in Cuba to 100. This means that the island has a mortality rate of 2.37%, in opposition to the global rate of 3.33% and the regional rate of 3.48%. We always mention the 2 evacuated patients at the start of the pandemic. Yesterday, 16 patients were discharged from hospital, still a negative balance between discharged and hospitalized patients, which responds to the number of hospitalized patients 10 days ago. Thus, we accumulate 3,474, or the 82.4% of all diagnosed cases in Cuba that are recovered from the disease. 4 patients are in critical state and 17 in serious conditions, which reflects the complexity of the disease and the high risk it entails. 1 patient reported as critical passed to serious conditions. Likewise, a patient that had been closely monitored passed to serious conditions. Another patient, reported as serious, is now being closely monitored. Concerning worldwide statistics, the world still faces a complex situation. 267,466 people were diagnosed with the disease only yesterday, for a total amount of 25,776,601 infections. However, we're certain that this figure will reach 26 million for tomorrow. Still more alarming is the 6,546 deaths reported only yesterday, which accounts for 857,448 fatalities. In spite of the new ways of treatment that are being discovered, these numbers remain high, regardless of the fact that not everyone has access to these medications and treatments. That said, the world's mortality rate is 3.33%. The region of the Americas, the epicenter of the pandemic, reports 13,635,382 infections, what represents the 52.9% of worldwide cases. 127,140 people were diagnosed only yesterday. Of the 6,546 world fatalities, 4,150 occurred in our region, what brings the death toll to 474,047 and a mortality rate of 3.48%. We would like to present a world map that shows in dark red the countries that report the highest number of cases. In our region, we have the United States and Brazil, and then it's Russia and India. These 4 countries top the list of the most affected nations in the world. The United States, with more than 6 million positive cases, Brazil, with nearly 4 million, India, with 3,769,524 infections. Russia reports also some million confirmed cases. In the United States, there were more than 1,000 fatalities, 1,091 to be exact. In Brazil, 1,215, and India reports 1,105 deaths. This is all the information on the behavior of the pandemic in Cuba and the world.